Here, I want to introduce a very good patient of mine, Danielle, to you, a 29-year-old white female who was diagnosed in June of 2016 with very advanced stage 4 nodular sclerosis in Hodgkins Lymphoma. At the time, she had opted out of conventional recommended treatments for chemotherapy, and she was seeking alternative therapies all through the country and beyond. She went to Mexico and received several non-scientific therapies which resulted in no improvement in her cancer. And when I saw her about 2 months ago in the clinic, she was seeking out and was referred by the friends and colleagues to us. And at the time, she was struggling because all the therapies that she had exhausted in the last 2 years, both with fate and all the accommodations that she had to make in her life to be able to receive those treatments, were unsuccessful. So when I saw her, we had a long discussion about the nature of her disease and what sort of conventional treatments are available for her. And she was very hesitant to try any conventional treatments. And we discussed about the nature of lymphoma and how epigenetic therapies had been explored and scientifically reviewed how to be able to control this disease by addressing the stem cell plasticity. And she wanted to try that. So we started epigenetic therapies with her at our clinic in conjunction with brentuximab, and she did not receive any sort of chemotherapies. She maintained a very good quality of life, which was her main intention, to preserve that. And she basically started to have very good results clinically as well as in her labs. Her initial IL-2 receptor, soluble receptor value was over 2400, and after just a few weeks of treatment this dropped significantly, as well as her LDH, which was elevated, and that also dropped to normal level, I believe from 300 down to 166 normalized. Further, she had restaged with a PET scan that showed very large mediastinal lymph nodes that she had shrunk and pretty much became completely inactive. The metabolic activity of these lymph nodes were up to 13.9, and post-treatment it dropped to background, or 1.8, which is very, very minimal residual disease. So at this time, as we speak, she looks forward to continue the epigenetic therapies with us on a maintenance regimen, and we will look forward to see her once or twice a month, and she could have a normal life, quality of life, and quantity of life. And our experience with using epigenetic therapies has shown that many of these patients stay in remission, durable remissions and sustained remissions beyond what is expected in patients who do not receive chemotherapy. So I'm very glad that she chose the right decision, and I'm very happy about the results that she had, and I will have her talk about her case after this. Thank you.
Hi, my name is Danielle, and I was diagnosed with Hodgkins lymphoma in July of 2016. I spent most of the next 2 years doing natural treatments just based on my own research and adding things in where I felt like they would be helpful. If you've seen it out there as an alternative treatment, I've probably tried it. And I would see a lot of success stories with other people, but nothing was really moving the needle for me. And a couple of times where it was stable, and it did shrink at one point, but it was slowly growing. So when I came to Nezami in June, I had had a PET scan in April of this year, 2018, that had showed it was, my main tumor was 14.5 centimeters in my chest area. It had been 9 centimeters when I was diagnosed. So, and there was showing some slight uptake in my spine, which the bone marrow biopsy was negative. So it was not in my bone marrow, but it could have been local spreading. We don't know exactly what that was in the spine. But when I started with Nezami, what I really liked about him that was different is that he's very scientific about his approach, and the fact that he took blood tests, even some tests that with all my research and my specific cancer, and I couldn't believe that I had never come across these tests, and my oncologist had never been aware of them either, as far as being able to track stem cell activity, and also to see which chemo drugs, if needed to add to my treatment, which my cancer would actually respond to by testing on my biopsy tissue. So I was very happy about that, all that extra information, that I just felt he's very knowledgeable. And so we started treatment in the beginning of June, and it's the end of, it's just beginning of August now. So I've been here 2 months, and there's been different points where we've been doing the blood tests, and I have been on a low dose of chemotherapy, brentuximab targeted treatment, but is not the standard. The standard is to do it also with AVD, or do the full ABVD, and I was just never comfortable with all the side effects and the crazy the crazy trip that is chemotherapy. I didn't want to really go through it, and I have had hardly any side effects on this treatment plan, and it's been amazing. I just got a PET scan back 2 days ago that I had gotten done last week, and it's showing hardly any activity at all anymore. We couldn't see anything showing up in the images and on the report. The SUV, which is the rate of uptake of cancer cells consuming glucose, so how active the cells are, it was at like a 14 before and had always fluctuated between, I would say, 10 to 13, and it's now at a 1.8 in the main area, and it looks like we're very close to being normalized with all my blood tests. 2 of them, 2 out of the 3 that are the main trackers have totally normalized, and the 3rd one came down by 30%. So, and we're hoping that that's going to normalize soon, and continue on with this plan. I've been just so happy. And another thing that I really like about Nezami is that before I had a lot of confusion on what to eat and what I thought was okay to eat or not okay to eat. And when you do your own research online, if you're one of those people who have been doing that, you are probably in the same situation where it's a scary thing when you think that, eating something might make your condition worse. And I'm still eating all organic and, avoiding preservatives and everything, but I've been able to expand my diet back to eat some eggs and some turkey sandwiches, and at one point I wasn't eating any carbs at all, and that was hard. And so even with being able to expand my diet back up while being on this treatment and getting these great results, I love that, because I'm just able to eat out a little more than I was, and have it be food be more of a relaxed part of my life again. So that's my story so far, and I really encourage you to have a meeting with Nezami, because he was able to answer all my questions, and I just can't be happier with him.